Guys, welcome back to my YouTube channel, A Life of Amy. You know what to do. If you're new to this channel, kindly like this video, click on the subscribe button, click on the notification bell to be able to get notification when I post videos. Then don't forget to drop your comment and don't forget to share this video. Thank you guys. So today we're going to be we're going to be talking about sexual incontinence. In the video that I did about what is squirting and method of squirting, I took my time to let you guys know the difference between squirting orgasm, the difference between ejaculation, and then the difference between sexual incontinence. Like these three things, I explained it to you guys because most people actually think they are the same thing. They are not the same thing. Someone actually reached out to me to make video on sexual continence more, so that's why I can elaborate more. So we are here today, and if you remember in that previous video that I did, I told you guys that sexual incontinence is the involuntary loss of urine during sexual activity. Okay, and then like when we talk about during sexual activities, systems or like two basic pattern I know or where these things pop up is during first of all arousal incontinence. Then what is arousal incontinence? That's leakage during arousal. A lot of people, maybe it's that part that time that you're very much aroused that you see that you start leaking, like there's an involuntary loss of urine. Yes, you see, like at that point you think, yeah, so you just see that it's happening. And then the second one is like the climaterial. Then talking about the climaterial is the leakage at orgasm. These two things are different things. Now, this is the one that takes place during your orgasm. That's why, like most times, you see a lot of people when they orgasm, you see like a different, you see urine. Yes, you just it's more like it's becoming like excessively watery. Normally, when you orgasm, it's not even supposed to be that watery. It's because they go through sexual incontinence, what I call climacturia. Now, there's a leakage. It happens to them during the part that they are during when they are about to orgasm or during when they orgasm. It just pops up at the same time. Yes, so and now these things, they are very common. Like sexual incontinence is very common. It's very common. A lot of people go through it, especially people that have prostate surgery and pregnant women, people that just women that give birth, that just give going still going through postpartum. So yes, they go through it too. Why? Because their body is still taking time to heal. So giving they just if it's normal delivery, especially normal delivery. If it's normal delivery, sometimes at the end of the day their body is still stitched, will lead to being stitched up. So now you see their body is still open. There are things about them that they cannot control, being that they are still healing and all that. So they can be an involuntary loss of urine. It happens to them often with women that suffers from pelvic floor dysfunction. I see the people that can go through that can experience sexual incontinence. Yes. So and another thing you have to know is for arousal incontinence is a leakage of urine. Okay, during arousal or foreplay, not necessarily like arousal, can still be like or during foreplay, anything that has to do with intimacy activities. A lot of time I get this question, people ask whether urine incontinence, whether it can be cured. Yes, it can be cured. It has treatment. There's treatment for it. Okay, it's just for you to meet a doctor. Now most women that give birth, they have this escape of urine. These things can come as a result of postpartum, so you can still like meet a doctor. And some people as time goes on that they heal up, all those things you see that it stop happening, it stop. Some people as a result of not really well taken care of during their postpartum period. Okay, so yes, now that becomes the result of not being able to meet up or do what they were supposed to do. So yes, there's treatment for it. So just for you to meet your doctor. When I say urine incontinence, it's still the same thing with arousal incontinence. Okay, so you don't feel like they are different things. No, it's still the same thing. Sometimes they can be referred to as arousal incontinence. Then there's something we call coital incontinence. Is the escape of urine, or yes, the involuntary leakage of urine, okay, during sexual activities. Leakage during sex still points to another disorder. Sometimes it's still because there are different four types of this whole sexual incontinence. Yes, so you leakage of urine can still come as a different type of disorder, like urinary stress disorder, which we all know as stress urinary incontinence. Stress urinary incontinence is like a V disability. Yes, it can be. It can still be tagged as such because urinary incontinence is tagged as a secondary issue. And then when we talk about types of sexual incontinence, we're talking about stress. We're talking about overflow. We're talking about urgency, and the last one, functional. Yes, it's functional. So there are like four basic types that most people don't even know. So much can actually trigger this thing, and yeah, it takes a different turn, which is still understandable. Stress incontinence comes as sneezing, coughing, or any other physical activities can trigger this. Then when we talk about urgency incontinence, is that part where you're feeling like you need to pee immediately. If I don't pee, I'm not sure I can control it. Like suddenly everything is just coming. You are okay. The next second, like become like a burst. Like if not now or never, immediately, right now, and you see it starts escaping, leaking, and all that. The overflow part is like when you dribble a little, okay, and then you just dribble, and you still can't empty your bladder. It's just like you feel like you want to pee. You dribble, and then you're now forcing yourself. Oh yeah, let me now, since I've gotten to the toilet, let me now pee and be okay. And the thing is no longer coming. You can't empty your bladder. That's part of it. Is a lot of things. I mean, then mixed incontinence takes you like a lot of things can make up mixed. Anything can go wrong, anything can go sideways, anything can go off, and you start leaking. Like usually when you want to pee, you're not even in a rush. You just like the way I'm sitting here, and next moment I feel pressed. I won't like even rush it. I'm gradually like trying to. Maybe I should go. This thing is not even serious. No, it's nothing that serious. I can still manage it home. Or, okay, let me use the restroom. Like it's not something serious. But in this part, you see, once your mind can even think, I want to pee, you don't escape. Now, one thing most people do is that they feel it's normal. A lot of people think this thing is normal. When you get older, you tend to escape once in a while. No, it's not normal, and you can treat it. That's the beautiful part of it. You can treat it. It's something that you need to really work on. It's not. A lot of people feel like when you get older, you address this thing becomes normal. Because I've had someone ask me this question, and I'm like, no, it's not normal. And you're like, no, now when you get older, my mom is obviously going through that. My dad is going through that. I said it's something you have to go and treat. Not everybody go through sexual incontinence, and most people don't know because they feel it's a normal thing. It's not a normal thing. And then when we talk about symptoms, symptom is like when you pee more than 8 times a day, okay, bedwetting, or like you there's escape of urine at every slightest provocation, like when you're at the gym, when you're laughing, when you're gisting with a friend, when you're jumping, when you're coughing, when you're sneezing, when you bend down to pick something, there's an escape. Just like when you bend down, there's this small fat come up for your body, like there's an escape of urine, like literally, even in the kitchen, you want to call someone, would you want to shout, there's an escape of urine. Maybe you just out of excitement, exclamation took place, he escapes. So these are like common symptoms of sexual incontinence. Some things that actually cause it, a lot of things can cause it, and sometimes some can actually be chronic disease. You don't even know like you have it. So yes, pregnancy, postpartum, a lot of pelvic floor dysfunction, people that just had a prostate surgery. A lot of things can make it, and sometimes certain medication can actually make you go through that side effect of medication, or even like urinary tract infection, constipation. So much can actually go wrong that will trigger all those things, pregnancy or after pregnancy, like I said. Certain beverages, there are things you take. There are people that when they take coffee, they notice they start going through that, or like alcohol, certain type of alcohol. Body works differently. Different thing can what different thing can actually trigger you. So you see, so much can actually be the reason these things are going wrong. Well, we don't know. And then when we talk about the uh, chronic causes, this one I say just temporary causes. Now we'll talk about the chronic causes. We're talking about diabetes, prostate surgery, stroke. We're talking about menopause. A lot of things can actually trigger this thing. Bladder issue, overactive bladder, and so on can trigger this. Pregnancy triggering surgery incontinence can be due to too much pressure on your bladder, maybe carrying a baby, because a lot of people carry in the I heard there are people that carry their child their carry their have their carry their pregnancy on their waist, and there are people that basically carry, I don't know the way they say it, yes. Then people that have pelvic dysfunction due to pregnancy can actually trigger it. So yes, I will always say consult your doctor. Go meet a doctor. Consult. See, these things are not things that you're supposed to be ashamed of. Anybody can be a victim. Take care of yourself, take care of your health, so that at every point you won't get to a point you're thinking of always putting on diapers, adult diapers, or putting on pad just to be able not to just to manage yourself, or when you want to go out you're scared of uncertainty, anything can go wrong. So please meet a doctor. Okay, thank you guys for watching. Hope this video was helpful, is helpful. Thank you guys, bye.